Aaron, how are you?
I am well. How are you doing today?
Good.
Did you see Brandon's email this morning?
Yeah.
Okay.
I think Van Ingram's not available either.
Okay. And I believe Sean declined the invite this morning, so I'm not sure if that was accidental or, um, but we shall see.
Yeah. It's Casey.
Good morning, everyone. This is Erin with the Department of Medicaid. It is not quite 9 o'clock and we're still clearing out the waiting room. We'll give it just a few moments before we get started. Steve, it is 9 o'clock and the waiting room is clear, but I currently only show you in case you logged in. Did I miss any TAC members?
Adrian Bush, for
Oh,
sure.
I did see her come in. There she is. Sorry about that, Adrian.
That is all I have.
Would you like to give it a moment longer?
Uh, but the waiting room's empty, right?
Yes, we have a few people kind of in the joining process, but
Okay.
they look like
I,
DMS staff
for
mostly.
health.
uh, I hate to waste people's time. So,
If you'd like, we could go ahead and get started and I can keep an eye out for other members as they
yeah,
join.
we'll go from there. We'll just get started. So, obviously, uh, we've done the three members that are on. We obviously 3 of 12 is hardly a quorum for anything, I don't think. Um, and next, so we can't do the minutes, so let's go right into the DMS update. Angela Sparrow, is that going to be you today?
It is. Good morning, everyone. Yeah, we'll provide some updates on the progress and status of the reentry demonstration. So it's hard to believe we're in July. And we continue to truck forward and move forward. So we're still targeting a 10/1 go live date. To have our system changes in place. Our again, the DOC and DJJ enrolled. So continue to make progress, still lots of work underway. We did receive some initial feedback from CMS on our implementation plan that we submitted last fall. We are reviewing their comments and their feedback, and we do plan to submit any updates or changes to them by the end of next week. So again, this will not hold, having approval or not having approval does not hold the state in terms of moving forward with implementation. In the review, there's really nothing outstanding, just more so some notes and call outs that they've made. And again, I think some minor adjustments, but there's really nothing. Definitely don't see any showstoppers or anything like that. So we were pleased to get that back, be able to review that. And again, doesn't seem like there's any big concerns there. So that was good to hear something back from CMS. One thing, again, in terms of implementation is, we are developing our monitoring protocols post-implementation, and that our monitoring protocols were due last fall as well. And we have not received feedback on monitoring protocols, which we know is important for ongoing implementation and evaluation of the program. I'm not sure if we touched on, but states did receive kind of a heads up, if you will, that CMS is making some changes to 1115 monitoring overall. So we do anticipate that CMS will release guidance around reentry demonstrations, very similar to, our SUD, or substance use disorder demonstration, where there's more prescribed metrics across states to align, that they can better, again, monitor the program's progress, more, again, streamlined. So they had not developed those yet, and those have been in develop. So we anticipate this fall receiving that guidance and those more prescribed metrics that we would be required to monitor and report, which again leaves us in a little bit of a situation where we are implementing in the fall and we won't have those. So we are moving forward with what we proposed in terms of monitoring the program and our plan that we had originally submitted. And then we may need to make some changes and some alterations later in the year to our monitoring once we get that guidance. So that's something we're just trying to plan for. So that may be a little bit of a change or a shift that we, as we get into implementation, may have to pivot and make some adjustments. So, but again, I think states are eager to get that guidance because it certainly does help the states in terms of implementation and monitoring and ongoing. So just wanted to make a note of that. Definitely continue to work with DOC and DJJ. We've, developed several workflows in terms of service delivery, especially around case management, pre-release, and again, continue to kind of develop out those standard operating procedures for DOC and DJJ and with our partners. We've had discussions around, again, that pre-release education and outreach to individuals and to the families, especially with our youth. Again, kind of when that will occur, how that can work and align with their reentry programs that they're already implementing, or again, will be implementing. So talking again and having those discussions, how we can ensure that we do have that Medicaid education information about the program, about the services before the individual's actually eligible. So we want to make sure that we have that to them. So we've had some discussions with partners around how we can incorporate that into the work that they're already doing. DOC and DJJ, again, both have submitted their enrollment applications, and that's under review with the department. So hopefully we can move forward with those and have official approvals and have them again actively enrolled with Medicaid soon. So working with our teams on that. On the pharmacy side, again, continue to work with DOC and DJJ, their vendors, in terms of system changes they may need to make to incorporate the Medicaid PDL for those release medications. And so again, if there are any medications that would need to be reviewed in terms of maybe changed to Medicaid covered, if there's something again that they would need to be switched to, if there's a prior authorization. So again, those process, what that workflow looks like, ensuring that we're monitoring that again well before the actual release. So if any of those things need to occur, proactive, and again, that would be in place prior to reentry. We did complete, we had several sessions with vendors around system changes, and the requirements have been finalized. And so those are moving forward. The development of those changes is underway. And again, targeting to have all of those system changes and those released and in production prior to 10/1. So it is a short timeline in terms of system changes, testing, etc. But again, still moving forward in that direction. Working with, again, finance, finalizing rates around the medication-assisted treatment services. Working again, we'll have to work with the actuaries in development of that pre-release capitation rate, which is going to be different and smaller with a smaller set of services. Certainly NCOs, I know, getting that information, there will be, a great deal of work to still occur there. We continue to work with the NCOs. They're, again, actively engaged. We have been collecting feedback and plan to collect some feedback around progress in meeting 10/1 implementation. We want to understand the concerns, risk, and how we can address those. So that's some of the discussion to have with MCOs. We have not collectively had the MCOs and justice partners together to discuss case management. We plan on doing that hopefully in our next design session. Really, again, was still trying to work out the process for DOC and DJJ in some of the programs that they're implementing. So that's certainly, one of those areas that we do need to have that collaborative discussion. Still needs to occur. Working with NCOs again on the IT requirements and system changes, making sure that they understand those and what would need to be in place in the timelines for that. And continue again, we just continue to review milestones. We've talked a lot about milestones. So all of those requirements that the states require to meet, review those on a routine basis. So that we can ensure that we're meeting those. We document our progress again, the items that we've met, and certainly again, those that we still need to complete before 10/1. So I know that's a lot of information, but there's a lot of work underway. So I'll pause there and see if you all have any questions or specific information you might be looking for. We are incorporating the CAA still within the reentry 1115 project. Just to give you an update on the CAA, I know we've talked about the CAA SPA. We do have a meeting with CMS, I think, next week. We're hopeful that we can get that SPA approval soon. I'm not sure of any other states at this point that have had that SPA approval. I think we talked about this state plan approval will be a little bit different than most. There will be a letter that the state and other states will expect to receive with that approval, that's going to outline what we need to do for full compliance for CAA. And we think that, again, there may be, an end of 2026 timeframe to achieve that. So again, we anticipate that that will be forthcoming hopefully soon. And again, continue to just include that requirements in terms of incorporating and working with the jails. Again, that is likely more of that work that kind of heavy lift will probably be post our 10-1 implementation and onboarding them within the first of next year would be that goal.
Angela, right now, you don't anticipate the monitoring protocol change impacting the go live date?
No, so we'll again move forward with what we've proposed in our monitoring protocol last fall. And then again, if we need to make changes once states actually receive that new guidance, then we'll do so and incorporate that into the plan. They are making a change. States typically report quarterly and annually. So I think what some of the interim guidance has been given is we can expect our reporting to change to a yearly annual cadence. So again, I think they're changing some of those metrics across all waivers. But again, it certainly, I think, will be useful for states to have that more prescriptive guidance and we can still have individual state specific metrics and measures that we want to report. But again, to be more streamlined across all states, that's certainly helpful. But no, we don't anticipate that will be a holdup to go live.
Okay, great. Anyone else have questions?
Steve, this is Erin. I just want to reflect for the record that Kevin and Kristen have joined us.
Okay.
Still don't quite have a quorum, but I wanted to make sure they were on record.
Okay. Any news from Nathan?
I've let in a couple people, but I haven't seen his name pop up, and I do apologize for not letting him in the first time.
He'll be fine.
I didn't recognize the name. I'm so sorry.
It's all right. Anybody else? Hepatitis C is just on the agenda. It's continuing having discussions, right?
Right. Again, that work is incorporated, I think, into the case management assessments, those health risk assessments during that service. In terms of any impact, we haven't received or heard anything at this point in terms of any federal changes. Certainly continue to communicate with CMS on all waivers and demonstrations. So we have not, at this time, heard anything any differently, which is good. No news is good news, right?
I agree. I just put on here the back where, any update, what that's going on or.
I can give that update, Angela.
Okay.
Thank you.
You're
Thanks.
welcome. So as of yesterday, the final federal rule went live. That's kind of how I'm saying. So all of the back members have been appointed along with what I'm calling the new MAC Big Mac members have also been appointed. All of those letters went out yesterday. We have some teammates that are reaching out to back members to start discussing things along the lines like if they would like their name to be public, meeting cadences, and how they would like that to be structured. Once the new back meeting schedule is structured, the new MAC meetings will be structured after that. We're hoping for a mid to end September-ish time for the back and MAC meetings. So right now we're just updating the website and reaching out to those selected members. And as we know more, I will keep you informed. I know you're usually the representative for the MAC. So once those dates are established, we will get those out to everybody just as soon as possible.
And the back is the beneficiary advisory committee, right?
Yes, sir. And so it's made up of people who have lived experience, advocates, caregivers. The selection process is selected by the commissioner. The new MAC, according to federal rule, will also now be appointed by the commissioner versus the governor's office. So what they really try to do with the back is try to make sure they've had an advocate or lived experience in all areas, waiver, MCO, fee for service, and then also spread out across the state. So we're making sure to get a good group of people. We're also keeping a tracking list of anyone who is also interested as membership expires, rolls over. At this time, I'm not sure if the back meetings will be public. That will be up to the back members. But as
Right.
that information comes out, we'll keep you guys updated.
And some percent of the MAC is back members now, right?
So 25%. So I think it's 7 members of the back. And my math might be a little off, but yeah. So I believe we have to have up to 25% by the compliance date, which is, I believe, towards the end of June of 2026. But I think we went ahead. We had several MAC members who were expired. So we were able to, I think, get a little ahead of that compliance date.
Very good. Any questions about the beneficiary advisory committee or the impact on the MAC? And as I understand it, the beneficiary advisory, the back meets at least 2 weeks before the MAC.
Yes, they're supposed to meet prior to every MAC meeting. So
Okay.
that's why we're hoping mid-September for the back, towards the end of September for the new MAC meeting.
Okay.
So we have been letting TACs know that they are welcome to still make recommendations, but they will be held until the next meeting. So it wouldn't be the 45-day turnaround because we
Right.
would have to wait for the next meeting. So that doesn't mean you can't make a recommendation, or if the TAC would prefer, instead of making a formal recommendation, they can just make an ask of DMS on things that we can work on, so there's no lag time.
Okay. And the MAC meets every other month. That might change, right?
It's possible, yes, sir.
Because the back could go quarterly if they so desire. That's their call, right?
Yes.
Which therefore impacts the MAC. Okay. I almost wish back and MAC names were changed. But that's just my simple mind. All right. Any questions for Angela? We got her on. Thank you, ma'am. Appreciate it. Good work.
You're welcome. Thank you.
MCO updates. Etna?
Hello, this is Shelley with Aetna. Are you able to hear me? My system is going a little bit weird.
Yes, we can.
Perfect. Our community outreach has several events this month, one with Job Corps, and then we have several already scheduled with like back to school festivals, and there's a foster care event, and we've also been doing some other foster care events this summer, just meeting with large groups of folks. And as far as the CAA, we continue to work with DJJ and DOC on figuring out what we're doing with that information sharing, and then just working on expanding what we already have in place with our Sky DJJ members, to expanding that to the rest of our members for the anticipated October 1st date for the 11/15 reentry waiver. So a lot of stuff behind the scenes, just trying to get organized and help the rest of our care management staff become comfortable with working with this population. And that's all.
Thank you, Shelley.
Yep.
Humana?
Morning. This is Kelly Bendwer from Humana. I just have a few brief updates as well to share with you today. Regarding our reentry program, we actually have begun receiving referrals again, so that's really exciting. Although our numbers have remained pretty low since the last TAC, we've had 2 new members identified, including one just yesterday. So, as for our community engagement team, we continue to be really active and involved in supporting reentry efforts. 3 representatives have upcoming meetings to coordinate and schedule additional on-site visits with prisons and jails. So we're really excited about that. And then looking ahead, on July 17th, we will participate in both the Healthy Reentry event in Louisville and the Bracken County Job and Resource Fair. On July 18th, we'll be present at Spiro Health Expungement Clinic and on-site at KCIW. On July 21st, our team will attend the Job Resource Fair in Kentucky Career Center in Covington and facilitate a reentry class at KSR. Finally, on July 24th, we will participate in the Heal Recovery event and expungement clinic at Whitesburg. So that concludes our update.
All right, thank you much. Appreciate it. Passport by Molina.
She usually does updates. So I will share from a care management perspective that so as Kelly indicated, received a
Kind of breaking up, Stephanie.
I'm so sorry. My are you hearing me any better?
Yes.
Okay. We did receive a referral from the reentry program. As Kelly said, it had been a while. We weren't getting them. We had a referral. We did engage that individual. And then I see Diane Corsi is on this meeting as well. Diane, if you're able to, could you come off mute and give an update from a community engagement perspective?
Yes, so Priscilla Schwartz usually has the update. She emailed it to Mark. I'm emailing her now to see if she can send it to me. I don't have the report. So if you can follow back with us once I get that report, that'd be greatly appreciated.
All right, will do. Thank you. United?
I see Elizabeth came off mute, but I don't hear her.
Neither do I. Elizabeth, we can't hear you. Of course, if she's responding.
There you are.
All right, thanks. Sorry about that.
Okay.
Yeah, I'm Liz Milburn from United Healthcare, Behavioral Health Manager of the Case Management Team. We have some internal reporting that we're getting of individuals who have been released from incarceration. We've been getting this data since August of 2023. And to date, we've reached 241 members. 110 have agreed to an HRA and case management services. So we've been doing some, within internal data, been able to connect people to services. And that is what I have for today.
Thank you. What does HRA stand for?
Health risk assessment.
Thank you.
Yep. So it'll identify, SDOH needs in a condensed form of assessment.
Very good. Thank you.
Sure.
WellCare, Centene.
Hi, this is Emily Daniel with WellCare. Not too big of an update. Of course, we continue to work towards the implementation of the 11/15 waiver. I know there's several work groups going regarding 1115, and we have all hands on deck anticipating that rollout on 10/1, and that does include looking at staffing just to meet the needs to go into those prison systems. In regards to the current referrals for reentry, WellCare still has a very low count. I don't think we've had any referrals in the past couple months, so we still anticipate that to pick up definitely after the waiver implementation, but hopefully we'll get some more referrals sometime soon. Our community engagement team, we continue to go out in the community, hold various events to address SDOH needs. And call out, we will be at the state fair. I think that's at the end of August, if I'm not mistaken. We'll have a booth there and promoting, healthy lifestyles, things like that. I think we're looking forward to engaging in that.
Oh, very good. State fair is always fun.
Absolutely.
It needs some healthy lifestyle at times, doesn't it?
With those corn dogs, yeah.
Yeah, that's right.
Right.
All right, thank you very much.
This is Diane Coursey with
Yeah.
Passport by Melina coming back. So for our community engagement, we have 5 expungement clinics coming up at our one-stop help centers. And then we've had 20 events off-site. Most of those are pre-release classes around the state. And that's all.
Very
Thank
good.
you.
Thank you. Appreciate it. Round robin member updates. I have federal Medicaid discussion, and I think, as Angela alluded to earlier, we're all trying to really understand what's going to be the ultimate impact. There's been all sorts of communication. The work requirement may impact people. The reporting requirement twice instead of once annually may impact access to folks, or access for folks. So we're trying to understand how it really plays out and the ultimate impact. It sure appears people will lose coverage. It also impacts the exchange, could impact some access there. Obviously, if you've seen it, the Kentucky Hospital Association, I think it's 37 rural hospitals are at risk. And that's obviously an access issue as well. So we'll see how it all plays out. Anyone else have anything on that, the federal Medicaid discussion? All right. Kentucky Judicial Commission Mental Health. The reentry work group continues to meet, just so you know. Adrian Bush, nothing productive. I suspect that pertains to the Medicaid, the federal Medicaid discussion, right, Adrian?
You are correct, Steve.
Yeah. So it's a very succinct analysis, I do believe. We're scheduled to meet in September. I am not available on September 11th. Changing the date is always too complicated. If someone else wants to run the meeting, that is fine. Or we could cancel the meeting. I may poll all the members and just see what they believe is the best choice. If any current members on have concerns about canceling a meeting, let me know. But we could do that if we have to for the September meeting. Anybody have a strong opinion either way? Okay. We'll send that out. No concerns. All right. Thank you, Kristen. All right. Future agenda items, I discussed at the meeting. We have no recommendations. We're really eager. Our November meeting will actually have some real, hopefully, people served and some real discussion points around that. I looked, our first meeting, believe it or not, was, I think September of 21. So we appreciate Medicaid's commitment. We've been at this for 4 years. But I think we're getting close to the point of actually having a waiver and a service package we can look at in more details.
Yeah, it's hard to believe. It's November. Yeah, just October, November is not that far. So
No, it's not. Same.
it's hopefully, yes, some good updates then.
I agree, Kristen. I think it'll be a better agenda come October 1 or shortly thereafter. So, all right. Thank you all. Y'all take care. Yeah.
Thank you all.
Thank you.
Yeah.
Thanks,
Bye-bye.
everybody. Have a wonderful
Thank you.
day.
You too.
Steve, I'll see you in a couple hours.
Correct.